Eye drops must be used the right way to be effective. Wash your hands well with soap and water. Dry them with a clean cloth. Get ready the eye drops and a clean tissue paper. Gently shake the bottle. Remove the cap and place it on a clean tissue. You may sit or lie down. Tilt your head back and look up. Use your index finger to gently pull down your lower eyelid to make a small pocket. Do not let the bottle tip touch your eye, eyelid, or eyelashes. This prevents infection. Gently squeeze one drop into the pocket. Close your eye gently. Wipe away any extra liquid with a clean tissue. Keep your eye closed. Gently press your index finger on the inner corner of your eye for 1 to 2 minutes. This helps the medicine work better and stops it from going into your throat. Put the cap back on the bottle and store it as instructed. You may taste something bitter in your throat. This is normal. If you need to use more than one type of eye drop, wait 5 minutes between each one. Helpful tips. Set a reminder or alarm for your eye drops. You can also link them to daily activities, like mealtimes. If you forget a dose, apply the eye drops as soon as you remember. For caregivers applying eye drops, use your index finger to gently pull down the patient's lower eyelid. Hold the bottle at an angle above the patient's eye. Do not let the bottle tip touch the eye, eyelid, or eyelashes. Squeeze one drop onto the inside of the lower eyelid. Wipe away any extra liquid with a clean tissue. Help the patient press their index finger to the inner corner of the eye for 1 to 2 minutes. Important information. Always read the label before using eye drops. Write the date you opened the bottle on it. Throw away the bottle if it becomes dirty or after the recommended time. If using eye drops and eye ointment, apply the eye drops first. Wait 5 minutes before using another eye drop or ointment. Some eye drops may blur your vision for a short time. If this happens, do not drive or move around in dim lighting. For contact lens users, remove your contact lenses before using eye drops. Wait 30 minutes before putting your lenses back on. Using eye drops correctly helps them work safely and effectively. If you have any questions or concerns, speak to your doctor, nurse, or pharmacist.